Hello all, I'm Dr. Gökay Bilgin from Smile Hair Clinic. So we are going to check our patient James hair transplant journey today. When we see the pictures before the operation, we can see that he has significant hair loss in the frontal part and also in the crown, and he has missing density in the midsection. In the midsection and in the crown, his hair loss is not completed, so his hair is mostly miniaturized, so they are not creating enough density. What we did is we focused on the bald spots in the midsection and the crown, and also advised him medical treatment for the hair loss. So when they are combined, you will see that they created a very good density, and also we were able to protect his remaining hair. So here you will see that we implanted in the frontal part and also in the crown and in the midsection. You will see that, and you can see that the density of the hair implanted in the frontal part and the crown is different than each other. That's because he had already some hair there. And what we do is we don't do incisions on the healthy hair, not to damage and destroy them. So we only do our incisions on the bald spots. After the implantation, let's see the first month. You can see that his donor zone looks sparse. I always tell the patients that in the first 3 months the donor zone will not look really good. But after 3 months its density and look significantly improves. So the patient should not really care about the donor zone look in the first 3 months. So we can see that he has shock loss, of course, and most of the implanted hair is gone. And also he still has some hair in the crown, and also his donor zone's density, when you look from the right side, you can see that his donor zone looks a little bit bad, but as I told you, we will see that it's really improved in the next 2 months. So we will jump to the 3rd month mark. Yes, his hair started to grow, his donor zone looks much better. And also his hair before the implantation fully growth, but there's still some tiny hair, but they are not creating enough density. Yes, let's jump to the 6 months. Yeah, his hair started to grow really well, his donor zone is covered with combination of hair transplant and the medical treatment, but he has still some missing density in the midsection, but they will improve in the upcoming months. And in the 9th month, yeah, his donor zone is fully restored. His hair from the frontal looks really natural and nice. Of course, they are not fully grown yet, so they're a little bit tiny, but the texture will improve in the next 1 year, so he will have a much better look. But if you look really carefully, that it's really hard to tell that he had a hair transplant. That's because in Smile Hair Clinic we really implant singular and fine hair in the front to avoid the unnatural look. And the donor zone looks really nice, and the crown and the other parts really look nice and dense. It's really hard at this point to tell somebody to tell him that he had a hair transplant. Hopefully in the next 1 year he will have a much better result. Thank you.